Disclaimer. The content provided here is for reference, information purposes only. The World Health Organization has declared an infodemic of incorrect information about the virus, which poses risks to global health.
The COVID-19 pandemic has resulted in misinformation and conspiracy theories about the scale of the pandemic and the origin, prevention, diagnosis, and treatment of the disease. False information, including intentional disinformation, has been spread through social media, text messaging, and mass media, including the tabloid media, conservative media, and state media of countries such as China, Russia, Iran, and Turkmenistan. It has also been reportedly spread by covert operations backed by states such as Saudi Arabia, Russia, and China to generate panic and show distrust in other countries. In some countries, such as India, Bangladesh, and Ethiopia, journalists have been arrested for allegedly spreading fake news about the pandemic. Misinformation has been propagated by celebrities, politicians including heads of state in countries such as the United States, Iran, and Brazil, and other prominent public figures. Commercial scams have claimed to offer at-home tests, supposed preventives, and miracle cures. Several religious groups have claimed their faith will protect them from the virus. Some people have claimed the virus is a bioweapon accidentally or purposefully leaked from a laboratory, a population control scheme, the result of a spy operation, or the side effect of 5G upgrades to cellular networks. The World Health Organization has declared an infodemic of incorrect information about the virus, which poses risks to global health. Types, origin, and effect. On January 30, 2020, the BBC reported on the growing number of conspiracy theories and bad health advice regarding COVID-19. Notable examples at the time included false health advice shared on social media and private chats, as well as conspiracy theories such as the disease's origins in Chinese bat soup and the outbreak being planned with the participation of the Pirbright Institute on January 31. The Guardian listed 7 instances of misinformation, adding the conspiracy theories about bioweapons and the link to 5G technology, and including varied false health advice. In an attempt to speed up research sharing, many researchers have turned to preprint servers such as AR14, BioR14, MedR14, and SSRN. Papers are uploaded to these servers without peer review or any other editorial process that ensures research quality. Some of these papers have contributed to the spread of conspiracy theories. The most notable case was a preprint paper uploaded to BioR14, which claimed that the virus contained HIV insertions. Following objections, the paper was withdrawn. According to a study published by the Reuters Institute for the Study of Journalism, most misinformation related to COVID-19 involves various forms of reconfiguration, where existing and often true information is spun, twisted, recontextualized, or reworked. Less misinformation was completely fabricated. The study also found that top-down misinformation from politicians, celebrities, and other prominent public figures, while accounting for a minority of the samples, captured a majority of the social media engagement. According to their classification, the largest category of misinformation, 39%, was misleading or false claims about the actions or policies of public authorities, including government and international bodies like the WHO or the UN. A natural experiment, an experiment that takes place spontaneously, without human design or intervention, shows a potential link between coronavirus misinformation and increased infection and death. There was one instance of this reported where 2 similar television news shown on the same network were compared. One reported the effects of coronavirus more seriously and about a month earlier than the other. People and groups exposed to the news show reporting the effects later had higher infection and death rates. The misinformation has been used by politicians, interest groups, and state actors in many countries for political purposes, to avoid responsibility, scapegoat other countries, and avoid criticism of their prior decisions. Sometimes there is a financial motive as well. A number of countries have been accused of spreading disinformation with state-backed operations in the social media in other countries to generate panic, sow distrust, and undermining democratic debate in other countries or to promote their models of government. Accidental leakage theories. A number of allegations have emerged supposing a link between the virus and Wuhan Institute of Virology WIV. Among these is that the virus was an accidental leakage from WIV. In January 2020, editors at the scientific journal Nature affixed a cautionary warning to an article by Richard H. Abright, who wrote about the WIV in 2017 and noted that the SARS virus had escaped from high-level containment facilities in Beijing before. The editors warned that unverified theories, unsupported by scientists, were being promoted to suggest that the WIV was the source of COVID-19. In an interview with BBC China, Abright refuted several conspiracy theories regarding the WIV, for example, bioweapons research, or that the virus was engineered, but said a laboratory leak origin could not be completely ruled out. Disinformation researcher Nina Jankowicz from the Wilson Center indicates the lab leakage claim entered mainstream media in the United States during April, propagated by news outlets. The theory first emerged in February 2020. When it was alleged that the first infected person may have been a researcher at the institute named Huang Yanling. Rumors circulating on Chinese social media stating that the researcher became infected and later died. This prompted a denial from WIV, who released a statement that she was a graduate student enrolled at the institute until 2015, and that she is still healthy and not patient zero. In April, this theory started to circulate on YouTube and was picked up by conservative media, National Review. On April 14, the U.S. Chairman of the Joint Chiefs of Staff, General Mark Milley, in response to questions about the virus being manufactured in a lab, said it's inconclusive, although the weight of evidence seems to indicate natural. But we don't know for certain. On that same day, Washington Post columnist Josh Rajan detailed a leaked cable of a 2018 trip made to the WIV by scientists from the U.S. Embassy. The article was referenced and cited by conservative media to push the lab leakage theory. Rajan's article went on to say that what the U.S. officials learned during their visits concerned them so much that they dispatched 2 diplomatic cables categorized as sensitive but unclassified back to Washington. The cables warned about safety and management weaknesses at the WIV lab and proposed more attention and help. The first cable, which I obtained, also warns that the lab's work on bat coronaviruses and their potential human transmission represented a risk of a new SARS-like pandemic. Rajan's article pointed out there was no evidence that the coronavirus was engineered, but that is not the same as saying it didn't come from the lab, which spent years testing bat coronaviruses in animals. The article went on to quote Xiao Qiang, a research scientist at the School of Information at the University of California, Berkeley. I don't think it's a conspiracy theory. I think it's a legitimate question that needs to be investigated and answered.